My name is Jacel Delgadillo. I belong to a group of women called Cannamoms. The reason this group came together, one of my main reasons is my son. As a mother, you expect your child to be born healthy, and you have all this future ahead of you thinking of what he's going to grow up to be. But at the age of 3 months, he had his first seizure. His seizure lasted about 5 minutes, and we went to the ER. We did all type of exams, and they found everything negative. So they said it might be, passive. He might not have another seizure again. So with time, his seizures started increasing. I'm not sure if a lot of you have heard of Charlotte, the little girl with seizure disorder. And Charlotte's Web, it was named after her. Well, my son has that. He was born with Dravet Syndrome. It's the most chronic form of epilepsy there is, and it's very hard to manage. So the seizures could last anywhere over 5 minutes, 20 minutes, 30 minutes, and I've experienced every single one of them. I've experienced all type of seizures. He's had the grand mal seizures, which are very common. He's had head drops, absence seizures, all the seizures, he's had them. He's 5 years old now. I moved back from New Jersey to Miami seeking help. So Miami Children's is a hospital well known here, and they have the Brain Institute, and they had a doctor that specialized in Dravet syndrome, so I came here for that help. My son was 1, we moved back. I have a daughter who's 10 years old, so she's 5 years older than him. She's very healthy, thank God. And when we ended up in the hospital here, I met with the doctor. We started all type of treatments available for him. We started a ketogenic diet. They even put him on a veterinarian drug, which I was very iffy about, but I said, if it's gonna help him, I'm gonna try it. So I tried every single thing available, and nothing was helping his seizures. One of the drugs caused drug-induced lupus, so they had to remove that medication from him. By removing the medication, the seizures increased. So now I was faced with 400 seizures a day. I couldn't sit him because his head will fall, he'll bang his head. It was dangerous. I think about it now and I'm like, how did I even think that was normal for him to be seizing 400 times a day? So I had heard of cannabis as an alternative medication for seizures. They had the CBD law that was passed here in 2014. I went to the hearing and I met 2 other parents that were there fighting for medications for their children, which was cannabis. This is when I first learned about it. I only thought, okay, CBD because of Charlotte, the little girl who had the same syndrome. With time, I learned, okay, my other mom has a daughter with cancer. She needs high THC, and it's completely different than the CBD that I'm thinking my son will need. So we started advocating, we started learning about cannabis, and that's how the group formed. We were fearless moms, pretty much, because we were trying to find anything and everything available to save our children. These are children with chronic conditions, children that need a voice for them, and we were the only ones available for them. So in Tallahassee, they passed a law in 2014. We learned that we needed more than just that, and the reason that I learned is because I went out of my way, and I traveled out of state to a legal state, and I started my son on CBD, but his seizures were out of control, so CBD by itself was not doing it for him. I would still have the hundreds of seizures. Then I realized that at the dispensary, I was able to get something else for him. We met throughout this whole ordeal that we were trying to fight to get cannabis for our children. We had the pleasure of meeting people like Tom Quigley and Carlos. And we started learning even more, and we started attending conferences. And we were fortunate enough to be offered to go to California. They were going to provide medications for our children instead of us fighting to get it legalized here. They offered for us to go there and start our children on cannabis, and that's what we did right before the elections in 2014. That was the first time that I had tried a combination of cannabis on my son. And for the first time in my life, he had half a day with no seizures. So that was, to me, like winning the lottery. Like, wait, I gave him THC and I gave him CBD and he's not seizing. And I remember the other mom and I were just sitting there waiting. So he was seizure-free for half a day. Unfortunately, it takes time, just like any other medication, and I call this my medication. But I was forced to continue giving him cannabis because I didn't want him to go back to having 400 seizures a day. So at this point, this is when we become fearless because we need medications for our children. We had to do it in the state of Florida. The law had passed, but nothing was available for them. So we had to make sure that our children continue with medication, and we continue giving them cannabis. And we make sure we found a way to get cannabis for our children to save their lives and to give them a better quality of life. My son is 5 now, and I can finally say that he just has maybe 3 to 5 seizures a week, which is a major difference. Thank you. It's a huge difference than 300 a day. And Cannamoms, when we came together, we started medicating our children. That was our goal. We started educating the public. Why do we need cannabis? This is when Carlos used me, which I didn't mind because I was just telling his mom my story and why I needed cannabis for my son. And it wasn't because we wanted it for pleasure. It was because it was the last resort we had, but honestly, it should have been the first resort and the first medication that we should have turned to. Because I've had to take him off cannabis completely for a couple of months because I was gonna try him on a study that they were conducting here. So I took cannabis completely, and it didn't give me anywhere near the side effects that I had when I took him off one of the seizure medications. So when I took him off cannabis, he just stayed neutral. I didn't have the major side effects that I was having with his FDA-approved medications here. And another reason that I would get upset is that I had to pay for the veterinarian drug because it's not FDA-approved, but I couldn't give him cannabis as an option, and I had seen the results that he was having with cannabis. This is my son right here. He used to wear a helmet for the seizures. He, thank God, no longer needs that helmet. I have it there for emergencies, but honestly, I just hang it on the stroller, and I don't really have to use it anymore. He would not be able to sit up. He wasn't alert. Now he's crawling, he's trying to walk. In therapy, they've seen the huge difference that this medication has made in his life. And when they will first ask me, what are you giving him? And I'm like, I just changed his meds. That's all I will say, because I was in fear. And as a mother, I shouldn't have to fear for a medication that's saving his life. So this is when we're like, we need to come out of the closet and start telling people, cannabis is what's saving him. This is why you need to vote yes for Amendment 2, because we need whole plant. It's not just one portion of the cannabis that we need for him. He needed more than CBD. He needs THC as well. There's other components, THCA, CBN, and he's used them, and it's helped them, and it works for him. So why should I even have to fight for a medication that's helping him? I shouldn't have to do that. And we started advocating, and we want to make sure that now for regulations that it's done the right way. Under SB 1030, which is the law that passed in 2014, you need the 90-day relationship. I have so many parents contact me that the doctor left he's not a doctor anymore, he's living out of state. They have to start a new 90-day relationship because this doctor's leaving, so they can no longer get their medication. If my doctor had to leave and I cannot provide medication for him, I would be devastated. I wouldn't know what to do. I mean, I would know what to do. But other parents, that are desperate, and that want to follow by the book, want to, continue not breaking the law, they wouldn't know what to do. And, and I'm thankful because I met Mike throughout this journey, and he's like, you know what? You need to do what you have to do to save your child. I mean, he has a child too, so I think he would have done the same thing. And I think anybody here would have done that. If you have a child that's chronically ill, like I could lose him to a seizure anytime. I never know how long the seizure is gonna last. But if he's having a seizure, now I just bring out a little bit of THC oil to stop that seizure, instead of using Diastat, which is known to stop seizures, but it's a benzo, and it's addictive. And he's taking another benzo that's very addictive, that's an adult dosage that he takes. I don't know if you guys are familiar with Klonopin or clonazepam. So my son takes 1 milligram of that in the morning and 1 milligram at night. He's only 5. He only weighs like 45 pounds. I think that's a lot, because I've met a lot of adults that only take 0.5 at nighttime. So my son is addicted to that. And in order to even start weaning him off of that, I'm gonna need THC for that. And this is something I've discussed, with his doctors, and I'm thankful that his pediatrician is on board. He's not on the list, but he knows everything that's happening to my son. So I feel good that I have that relationship with his doctor. Not all parents do. They're scared to death to even mention anything cannabis related to their doctors, because they're afraid that the doctors are gonna call CPS on them. And it's something that I was afraid of too. Like when I went to Colorado, when I went to California, when I had to bring his medication, I was terrified. What if they call CPS on me? What if I lose my child? What if I go to jail? And all I'm doing is saving his life. I know this is working for him. Why should I fear that? So now we want to go to the hearings, which here in Broward County, it's going to be on Tuesday, because we want to make sure it's implemented the right way. This is for our children, this is for adults, this is for patients. And I had this discussion with my cousin who's on the conservative side. And I told her, they cannot ban smoking as an alternative for cannabis. And she's like, it should. They have pills available. I'm like, no. The pills that you're talking about is Marinol. My son was also on Marinol. My son he doesn't speak, so he will cry all night every time I had to give him a Marinol. And I spoke with a parent, and this parent told me that she knew an adult that was on Marinol, and when the patient would take Marinol, he felt like he was going down a roller coaster. So I'm like, I can't even imagine how my son feels, being 3 at the time, and he wouldn't speak. So I'm like, he must feel horrible. Like, I don't know what the feeling that he's had, what is he feeling? So I stopped the Marinol and I substituted it for oil. And I got better results with the oil than the actual Marinol. So I told her, I'm like, no. And if a patient finds relief smoking, why are you gonna take that away from the patient? It shouldn't have to be. Why are you gonna take away edibles? If the patient doesn't wanna smoke and they wanna use an edible, why are we gonna take that right from them? When you're giving my son medication, you're not telling me how you're gonna give it to him. They will give it to me in a pill form and I have to crush it. They will give it to me in liquid and I will give it to him. It didn't matter which way, whatever way they will prescribe it and give it to him, I will have to give it to him. So why are we gonna stop patients from taking their medication and telling them how they're supposed to take it? It should always be between the doctor and the patient. And I'm thankful that my doctor is in agreement and he's, for medical marijuana, because he knows, he's seen it. He's seen the changes in my son. And anybody that met my son met like a child that was constantly seizing. You couldn't hold them without feeling his body tremble because it was nonstop. Now you can hold them and I just have to, I can't even bring him to events because I can actually hear his voice now. He's screaming. He's alert. He's touching everything. And I'd rather have a child like that than having a vegetable, because I want my son to be able to play with toys. He's only 5. He's delayed, but he's coming out. I'm eating my son now because of medical cannabis. And I give it all my credit is to medical marijuana, because it's now he's only down to the Klonopin and the potassium bromide. That's it. He was taking multiple medications. I have pictures of him with a bunch of pills in front of him and syrup medications for him. So if I wouldn't have turned to medical cannabis, I think right now he will be taking a lot more medications, which is what usually happens. So every time he will have a seizure, I'm like, I'm not going to the hospital because then they're going to increase his medicine. So no, I would just treat it with medical cannabis. My doctor was aware of it, his pediatrician. So I'm thankful for that. This was him. Usually, this was my life, pretty much. Last year I probably went to the hospital once, and it was because of all the medications that he was taking. They had to remove all his teeth because medications ate in. It's baby teeth, but just that surgery by itself, we spent about a month in the hospital, and they had to give him morphine in the hospital because doing a root canal for an adult hurts, and it's painful. Doing an extraction, they had to extract 10 of his teeth, and the rest that were saved, they had to be done as a root canal. So that is what medications cost for him. And so we were in the hospital, his blood pressure went down, his seizures required oxygen, and bringing him back because it went down to 0, his oxygen level. So this is the scary life that I don't want to go back to. And I'm going to continue fighting for medical cannabis. We're going to continue fighting that this is implemented the right way. And this is why we're fighting for medical marijuana. One is for my son, for adult patients that we know of, because it's not just children. And it's for everyone. Like, we want to make sure that it's implemented the right way for them. So when you're out there thinking of cannabis as a business, also think of us as parents fighting for this medication, because we already have enough on our plate to be fighting for equipment and for other things. Half of us are not allowed or able to work because we have to take care of children like this. So it's also, when we talk to the business side, we're like, you have to think of compassion as well, which I'm very lucky that I've come across a lot of people very compassionate and have helped out with his medication. So if you guys have any questions, this is his sister right here. She's gone, and she's lived through all this since she was 5. She's been in the hospital with us since he was a baby, and it all started at 3 months. And with Cannamoms, a lot of people reach out to us, a lot of patients. They want us to help them find doctors that would charge a reasonable price for the recommendations right now. Or a doctor that's not gonna, I had a mom that she went to a doctor right now. After the 3 months are up, I think he's charging her a registration fee, which it was the same amount that he charged her for the first visit. And she's like, I feel like I'm being scammed just to get him on the registry. I'm gonna change doctors. Send me your doctor's info. And I said, get in the registry first, because if I send you my doctor's info, he will not scam you, but you will start from scratch. You have to start from, you need to build that 90-day relationship. And that rule is the worst one we've ever had to encounter. Why do you need a 90-day relationship when my son has been seizing? I could give you his history for 5 years. He's been seizing for 5 years. What other information do you need to know that will tell you that he needs cannabis? He's been a medical marijuana patient already. Why do I have to start from scratch? So that's one of the rules that even his doctor's not in agreement with, And if my doctor had to leave out of state and I have to start from scratch, I have to start again, day 1 to day 90, to become a patient again. So it's a lot, that's happening, and the fact that I have to wait until his 45-day recommendation is up, it's when I get the new order. And I've been to a legal state, and it's not like that. I was able to get CBN, and it helped him go to sleep. Not just the CBD. I was able to get THC along the way, and it helped him with the spasms and the seizures, and it helped as a rescue drug. So it's a lot. And the rules, we have to make sure that we are there to speak about them, to be able to tell, because the politicians that are making the rules are not going through what we're going through as parents of chronically ill patients and as patients fighting for their lives. So We have to, if you're able to attend any of the hearings and speak on behalf of us, do it, please. You know, I'm gonna be going to the one on Tuesday. I had to go out of my way and find, my mom has to take off so she can watch my son, and the nurse has to make sure she's there so she can help my mom. So my mom can help her with my son because we never leave him alone. But I'm gonna find my way to make sure I get there, because if I need to speak and testify, I'm gonna do it, because I wanna make sure it's done the right way for all patients, not just my son. It's everyone that's involved in this, so.